And thank you guys so much. But in all sincerity, I love what I do. And as I said, I've been in substance abuse direct counseling for about 25 years. I could update that one. And I've been providing services at all levels of treatment. About 3 or 4 years ago, we opened up a practice called Ethos. It's an intensive outpatient program in Center City, Philadelphia, in Plymouth Meeting. And our hub, my office, is in Westchester, Pennsylvania. And we pivoted to telehealth in March, and we had to because of the pandemic. And this pandemic has affected us all in a lot of different ways. But especially in the substance abuse realm, in the respect that we're all struggling with mental health, but the impact of isolation, and isolation being a huge factor when it comes to mental health and substance abuse, has been a major hit to a lot of us. So appropriately, the opiate epidemic has gotten the press in the last 5-7 years, and appropriately in Philadelphia region. Philadelphia is known for having a significant opiate issue, and that is no joke. Has appropriately gotten the press, and I'll kind of unpack that in a little bit. But underneath it has been a couple other things that have been happening. One of which I call the alcohol epidemic, and that's my term. With all the bars being closed the past 12 months, with all the nightclubs, with all the classic spots that people purchase and enjoy alcohol. I'm not a prohibitionist. But for those people that struggle with substance abuse, it would be good to know that alcohol sales have gone up 14% with all those avenues of places where people would classically buy it. So what does that mean? What does that mean to a provider like myself? That means that, what we're looking at is people drinking at home by themselves, untethered, without accountability, without even like a financial slowdown, how expensive it is to drink at an event, or at a bar or nightclub. People drinking and consuming a lot of alcohol at home by themselves, untethered, is problematic. And so we've seen it as treatment providers. We were able to dedicate one of our tracks of our Ethos Intensive Outpatient just to alcohol. And the 40, 50-year-olds with cirrhosis of the liver that are ended up with us is significant and acute. And the other big thing that I talk about is the misinformation of marijuana. And again, I'm not a prohibitionist when it comes to marijuana, but would I like you not to smoke pot? Absolutely. Would I like our kids not to smoke pot? Absolutely. But when it comes to the exposure value of the medical marijuana, I'm more pro-brain adolescent development than I am, anti-pot, in the respect that I want kids to be informed and understanding the messaging around this. So kids hear it's legal, it's okay, or it's medical, it's okay. And so the misinterpretation of what kids are saying when they smoke this thing called marijuana, you guys and ladies know this, that the marijuana back in the 80s, I'm not going to ask anybody to raise their hand if they ever smoked pot in the 80s. But if you did, it was like 4 to 5% THC content in marijuana. That's the hallucinogen, the intensity of the high, right? But in the year 2016, 17, it's like 30 to 40% THC content in the plant. And then we talk about what kids are really smoking today is dab pens and vape pens and juice. And that's like 95% THC content. And I just hung up the phone right before our talk, right before meeting with you guys tonight, with a mom that was concerned about a child. And she was saying, but he just smokes pot. And I said, and I have to ask this classic question I ask every time now in the past couple of years is he smoking plant? Is he smoking dabs? And she said, oh yeah, no, he says it's healthier to vape it and cleaner. And so he's vaping and he's doing all this dab pens and all this. And I'm like, man, I got to slow you down right there, because that stuff is the stuff that, last fall, myself and my practice were hospitalizing a kid every couple of weeks with psychosis, a break from reality from just smoking pot. And that's the critical concern is when I met with this mom and talked to this mom, I had to inform her that, it's a lot different. It's kind of like saying, I drink, and do I drink a glass of wine or two, maybe a week? Or am I drinking a gallon of vodka a day? That's the differential that I'm trying to get across, the proof differential that so many kids hear, I'm just smoking pot, or parents or families. So there's a misinformation, a disconnect that I could talk about as well. So that's been happening the last couple of years. So when Erica and Marty asked me to talk tonight, I just wanted to briefly kind of go over some of these updates and let you in on some of what we're seeing as treatment providers not to scare you, but just to explain that the truth, the reality of how the impact of COVID has made us all kind of work isolated and alone, but has really kind of triggered some of the mental health components. A statistic that came out of Treatment Research Institute at Penn that has been done about 2 or 3 times in national organizations with young adults, especially that struggle with substance abuse issues. 86% of young adults have a secondary mental health issue like anxiety, depression, and something else. So if you think about it, 86% of young adults, I actually think that number is low. I think that's actually, you could be higher. For adults, NIDA, National Institute on Drug and Alcohol, came out and they said 6 out of 10 folks with substance abuse have a mental health issue. And NAMI, National Alliance of Mental Health Issues, came out with their own independent study. It said 6 out of 10 people with a mental health issue have a substance abuse issue. Now, does everybody follow that? So it's pretty consecutive that the crossover is there. That, when we talk about substance abuse, it is a mental health epidemic. There is a mental health component. And this last year, with isolation, with people being told to work remotely, and some of our folks looking at, their resiliency skills aren't the best when it comes to working from home by themselves, losing their routines. And I don't know about you, but I didn't know where my workday started and ended at the beginning of the pandemic. And I had to create some boundaries. I had to create some routines. And my wife made fun of me. I would wear shoes and pants and I would show up to this setting like I was showing up to work. Like I'm still wearing dress shoes right now because I mentally had to, the industrial psychology of actually showing up in that way. I really had to dress to that level of availability to, this is the meaningful time of work. And I'm literally Mr. Rogers. After my 5 o'clock session, I was taking some phone calls. I took off the shirt, I put on a sweatshirt, and it helps mentally. You guys know the Mr. Rogers analogy, that helped me to kind of let go so that I wasn't, kind of in that work mode. But so many of our folks and so many of our kids, when it comes to this device, they don't know when to stop, and then they get the wearable devices. And then in the next, when does work end? And so that stress management, life management, and then people rationalize drinking, and that's where people really have gotten into trouble with substance abuse. So a note on technology. I'm not going to go a full technology piece, but I do want to make mention of this thing. I don't know if you've ever seen this thing called a cell phone, an iPhone. I don't know if you could see this. Everybody knows what this is. Okay. I do use humor. I do fail at it at least once a week, but I do take my job seriously. So the iPhone is a beautiful device, right? And I just gave this talk at a local high school today, and where I want to make sure I can say where I was. So I was at a high school, I'll just say a local high school, and I was talking to the kids about, addiction, and not just substance abuse, but I talked about process addiction and technology addiction. And one of the setups, and a lot of places and times these kids are spending a lot of time, especially this year, is on social media. And I thought I wouldn't have to talk about FOMO. You guys know what FOMO means? Fear of missing out. So kids always, go on Instagram or Facebook and they miss the party. They feel like they miss out and they weren't invited to this or that. So I thought with the pandemic, everybody's home, right? I thought, like, why would I be talking about FOMO? Well, kids are still partying. That's the truth. And kids are feeling left out. And the pockets of parties that are happening at the university level, at the high school level, are still happening in smaller pockets. So kids actually are feeling more of a sense of FOMO, fear of missing out. And so a lot of kids are feeling like they have to keep up with the statuses of people. And so they're spending a lot more time on social media, bored, alone, and isolated in their own homes. And then I'd explain to a lot of kids that don't get it, that they're up against science. They're up against years of research. They're up against algorithms that these technology companies, specifically TikTok, spends a ton of money in research on identifiable, trackable data. So they're flashing through these 15-second videos. Well, guess what? What is similar to flipping through these videos or flipping through social media? It's just like gambling. So the same neurochemistry that goes off in your brain when you're dialing through Instagram or speeding through TikTok is the same neurochemistry as that next hit. Maybe I'll get that next time I'll win, that next video will be funnier than the last video. So these kids are getting more and more kind of geared up for gambling. So the same neurochemistry that happens with technology addiction, video game addiction specifically, that's where the research really is. And they've done recent research on TikTok, but not extensively. But there is a strong parallel. The same neurochemistry that happens with video game addiction happens with gambling, happens with stimulant addiction. So it's a very clear setup and something that young adults need to be aware of. Again, this past year, so many of our families are burnout. So many of our families have been working from home. I respect all the moms and dads that had to pivot, work from home, and deal with education on the home front. Education this year, I respect all the schools and teachers that tried their best to pivot. And we all tried our best, right? But a lot of kids lost a year. A lot of us lost a year. A lot of us lost people. And so to regain that, to restructure that, to get a better footing at that, is so important, so powerful to get out of this. And so this anticipatory anxiety of what's going to happen next, a lot of us are worried about how this roll out and how things are going to go in the next 6 months, 9 months. And a lot of our youth are worried as well. And so our worried youth, our worried adults, this stress management, this anxiety management, I know I was here to talk about substance abuse, but that's underlying that and pushing substance abuse in a direction and affecting people's decisions to turn to use substances, to turn to use marijuana, alcohol, and opiates. First is a note on opiates and the opiate epidemic. And I was dealing with somebody today, a clinician today. I do clinical supervision, and the clinician asked me, have you ever heard of somebody calling fentanyl a drug of choice? And I said, unfortunately, yes, that is actually a thing. So fentanyl was originally known in the last 5 years as being the overdose killer, the thing that actually kills our folks and our loved ones. But what happens is, if you talk to any emergency room doctor, if you talk to any emergency room in the city of Philadelphia, greater Philadelphia region, in Chester County as well, that the ERs, when they do a drug test for kids coming in for heroin or heroin overdose, it's never heroin, it's always fentanyl. And so they're not even seeing heroin, they're seeing only fentanyl when it comes to the type of overdoses that are happening. When I first started giving the lectures around opiate epidemic and the start of it and where it all began, I was wrong. I'll tell you where I was wrong. I was wrong when I started talking about the impact of the internet and how kids were getting it delivered to their doorsteps and they're buying it online and exposed to it online. And yes, that is a facet of it, but it wasn't it. 85 or 84%, I forget the exact number, it's 84, 85, I'll look it up at the end, percent of kids that get exposed to opiates, the first time that they get exposed to opiates is in parents' own home medicine cabinets. And so it's, if not yours, it might be some neighbors or something else. So any chance I get the opportunity to speak in front of parents and loved ones, if you have any, and I'm a culprit of it today. If I have I don't even care if I have an old prescription for, an antibiotic. I got a 2-year-old running around now. I don't want him kind of picking it up, right? But I don't want, to have any families have that on their conscience that they don't want to have that exposure. And a lot of our families say, oh yeah, that's an old medication bottle. Oh, I keep that just in case. And so that's where 80 some odd percent of folks get exposed to opiates, their first exposure in someone else's medicine cabinet. And that's where it's an innocent thing. It's an innocent kind of connection for our folks. So I just challenge you guys to talk with other families and not be afraid to have these awkward conversations. And one of the other huge factors when it comes to substance abuse is protective factors and having connection and having a community. And that's why Speak Up works. And that's why this organization does a great job to connect you guys to not be afraid, to have community connection, community relationships, community support, to not feel alone. The stigma of addiction, the stigma of mental health issues still exist. And any which way I get a chance to talk with parents and families to say, like, my sincere goal is to get to a point where we're talking about mental health, like dental health, and dental floss like mental floss. And I want to get to a point where in our society, we're saying, I got to go to my therapist, like we're going, I got to go to my dentist. How often do we talk about our teeth, our self-care, going to a physician? I want kids to feel okay and feel it okay by their abilities. And when I talk to kids, they're more open and more talking about going to therapy. and seeking help and getting help. And I want families and parents to as well, and not be afraid to ask for help. And parents, you're 1,000 school teachers. Your kids, your grandkids watch what you do more than what you say, unfortunately. And so how you conduct yourselves and how you live your lives. And that's my challenge for you tonight.